Hello everyone. Today I would like to talk about the role of critical thinking in my future profession, which is becoming a nurse officer. I believe critical thinking means making careful decisions by examining evidence, reacting based on emotions or opinions. Critical thinking is important in every profession, but it is especially essential in nursing because people's health and even their lives depend on accurate decisions. The first concept is evidence. Our textbook explains the more evidence there is to support a claim, the more reasonable it is to accept that claim. This means we should make decisions based on reliable evidence instead of guesses or personal opinions. For example, if a patient suddenly develops a fever after surgery, a nurse should not simply assume it is normal. Instead, the nurse should assess the patient's symptoms, review vital signs, examine laboratory results, and report the findings to the physician. Evidence helps healthcare professionals make safer decisions. The second concept is reflective skepticism. The textbook explains that effective critical thinkers temporarily suspend judgment while examining the evidence with an open mind. This does not mean doubting everything. Instead, it means avoiding quick conclusions until enough evidence has been gathered. For example, a patient may say that a medication causes dizziness. Rather than immediately assuming the medication is responsible, a nurse should consider other possible causes, such as dehydration, low pressure, or another medical condition before reaching a conclusion. The third concept is logical fallacies. Logical fallacies are mistakes in reasoning that can lead to poor decisions. One example we learn is the false dilemma, which reduces complex issues to only two choices. In healthcare, problems are rarely black and white. For example, a patient refusing treatment does not necessarily mean they are being uncooperative. There may be financial concerns, fear, religious belief, or misunderstandings. Critical thinking helps nurses consider multiple possibilities rather than making simplistic judgment. My professional goal is to become a nurse officer. A nurse officer provides medical care while also serving as a military officer. According to U.S. Army, nurse officers assess patients, administer medication, coordinate healthcare teams, educate patients, and provide emergency care in hospital and field environments. They often work in stressful situations where quick but accurate decisions are required. Because military environments can be unpredictable, nurse officers must communicate effectively, solve problems under pressure, and make ethical decisions. These three critical thinking concepts are essential for a nurse officer. First, evidence helps them make accurate clinical decisions based on patient assessments rather than assumption. Second, reflective skepticism encourages them to carefully evaluate all available information before making important medical decisions. Finally, understanding logical fallacies helps prevent errors in reasoning, allowing them to avoid biased or oversimplified conclusions about patients and medical situations. Together, these skills improve patient safety, teamwork, and the quality of healthcare. In conclusion, critical thinking is one of the most important skills for a nurse officer. By using evidence, practicing reflective skepticism, and avoiding logical fallacies, nurse officers can make better decisions, provide safer patient care, and respond effectively to challenging situations. Thank you for listening.